In tonight's Verify, after the coronavirus pandemic, many are wondering what the next devastating disease will be. Tonight, KENS 5's Jeremy Baker looks into a claim about what we could expect in the future.
COVID was bad enough, but what if another disease develops that could threaten the lives of many more people than had died during the pandemic? That leads us to tonight's claim. Is it true that a drug-resistant superbug could kill tens of millions of people by 2050? Our sources for this Verify are Dr. Jason Bowling, an infectious disease specialist with University Health and professor of infectious diseases with UT Health San Antonio, and the results from a study by Global Research on Antimicrobial Resistance, or GRAM. Dr. Bowling says the problems are a growing population and bacteria that are becoming increasingly resistant to antibiotics.
This will continue to increase based on how it's gone over the last 20 years. And so that is the big concern, that this really could be a reasonable estimate based on population growth and growth of these resistant bacteria.
He told us people need to have access to vaccines and not over-medicate.
We need to make sure that antibiotics are used appropriately. So we're not treating viral infections with antibiotics, because the more bacteria get exposed to antibiotics, the more resistance we see.
The GRAM study looked at 204 countries between 1990 and 2021 and found those over the age of 70 had an over 80% increase in deaths attributed to antimicrobial resistance, and projected up to 169 million deaths could occur by the year 2050. So yes, it is true, a drug-resistant superbug could kill tens of millions of people by 2050. Dr. Bowling also stressed not to use antibiotics with a viral infection because they just don't help. For the Verify team, Jeremy Baker, KENS 5.